when this pandemic started, it was all new. We were not all prepared. Our hospitals were not designed particularly for this disease or this pandemic. The challenge was that it was spreading very quickly, and it could spread easily outside and inside the hospitals. It could spread between patients. It could spread from a patient to a staff member. So our hospitals were designed basically they were open planned. So we had wards, we had some beds on the wards. And if you put a COVID patient, patient who's infected with a COVID or is quasi-COVID on these beds, it could easily spread from patient to patient, or it could easily spread to the staff member. Although the staff, they could be prevented by putting an appropriate PPE, but still it could spread between the patients. Hence, there was a need to change the structure of our ICUs. We were lucky in Waterford in terms of wards. We had the Dunmore wing, which were all isolation beds. So that was good, but still our ICU was open, floored. Hence, we had to work on this ICU for the last few weeks, and we have upgraded it. We have changed it all to a cubicle plan now. So all are isolation cubicles, which means that people are at a lower risk of spreading the disease between the patients and from patients to the staff. For the last 7 weeks, we have been working hard, and it's done now. So we have changed it from open plan to isolation cubicle. And they're all negative pressure rooms. That means there is very little risk of cross-contamination.
Does it make your job easier? And I must add to the dignity for the patient as well.
It was needed, to be honest. Even if you ignore the COVID, there's always a risk of cross-infection between the patients. If you look at other sorts of infections, it could easily spread from a patient to patient. But now we're lucky that our management has provided us all the resources, thanks to Ms. Grace Rothwell for providing us all the resources, and we have finished the job. So hence it makes it easier for the staff to work, and it's easier for the patients as well. It prevents their dignity. They are in an isolation cubicle. It's like staying in a room and with their own equipment inside the room, and little interference from outside. If people are moving in the ICU, whether it's the staff or it's the other family members or it is the other patients. So it's good for the dignity of a patient, I suppose.
It has been a challenging 9 months. Working in critical care in particular, you're dealing with the sickest patients.
We are actually. So it's been difficult all along, for all 9 months, if you see, it was difficult. I think the worst months were before this pandemic started. If you think from February to March, to be honest, we were in a great difficulty at that stage because we knew our hospitals are not prepared for all this. We didn't have all the resources. We didn't have the manpower trained to deal with this type of pandemic. So we've worked all along during last 9 months, So in terms of, we have acquired a huge amount of equipment during the last 9 months, which includes beds, ventilators, monitors, and we've increased the oxygen supply, which was the basic thing needed. We've increased the supply to all the hospitals. We've trained a large amount of staff, including medical consultants from other specialties, nursing staff. We have trained all the trainees who come across to the hospital how to deal with the basics of these critical care, of these sick patients. And it was very important to implement a large number of, effective protocols which could help us quickly identify and then isolate these patients so that it doesn't spread easily in the hospitals. And as I said, the hospital structure has been changed. So it's been difficult to get all this. But we're still not out of the woods. We still don't have a definitive treatment for this disease. There's no definitive treatment. There's no vaccine as of now, but it is going to be. There's a huge hope that it will come up in a few months' time. And again, it's been a difficult 6 months to 9 months working with these. We've had huge mortality. If you see all around the world, from the ICU point of view, it's been a huge mortality in every corner of the world, ranging from 40 to 60% of patients dying in the critical care. But touch wood, we've been lucky here in Waterford especially. I'm proud to say that we haven't had any mortality in our ICU, which includes patients ranging in age from 40 to 85-year-olds. Everyone has done well. Thanks to the staff, thanks to the management, and thanks to all the doctors and nurses who are working under these difficult situations. And especially to our, CNM, which is very good, Sandra. We have our Sandra McPherson is our CNM. And it's been very well managed in the critical care. And the results are obvious.
That's very significant. That's a huge deal. It's probably unheard of in any other hospital in the country.
It is. Look, first of all, I must thank all the people, who have adhered to the social guidelines, who have adhered to the public health guidelines, whether it's social advocates of face masks, whether it is cough advocates or social distancing or preventing all the social gatherings. So huge thanks to all the people who have helped in all this. And we still need it. We need to continue in our efforts for now. And then again, in the hospital, thanks to all the medical staff, the nursing staff, and we've had all the management helping us. And like not only the management, if you look at, it's been a huge work for the builders and construction people, involved in changing the structure of the hospital. We always thank doctors and nurses, but these people get forgotten sometimes, to be honest. But they worked really hard. And in terms of ICU, I'm lucky to have my colleague and my wife, to be honest. We're both intensive care consultants, and we worked hard for the last 9 months inside this intensive care unit. Dr. Shiba is her name. She is the intensive care consultant who works with me in the intensive care unit. So we worked hard together, and we have achieved good results for now. And I hope we continue to do the same.
And the numbers have been creeping up again, even though we are in a kind of a lockdown situation again. The numbers in Waterford have been rising. Is that something that concerns you?
Well, to be honest, numbers are rising. But look, we are doing our best, and I suppose everyone is doing his best, including people who are there outside. But again, the best thing for me at this stage is that we're at least prepared to deal with it, In February 2020, we were not prepared at all to deal with this. But now, at this stage, at least we have the resources, we have the structure in our hospitals where we can deal with this. But again, look, everybody is at risk, and everybody is at risk of dying from this disease. I can't say that anyone is immune. So anyone can die from this disease, whether it's young or old, to be honest. So it's important to just continue all these efforts until a definitive vaccine is available and we get some immunity. And then we might be back to our normal lives.